Hello.
Hello, am I audible?
Hello, am I audible?
Hello, hello, Dr. Madhvi,
Yeah,
ma'am.
am I audible?
Yes, your voice is a bit low, ma'am. Hello,
Hello.
can you hear me? Hello, hello, ma'am. You are muted, ma'am.
Hello, am I audible?
Yes, ma'am. Kindly increase your volume of the device.
Yeah, am I audible?
Yes. You are audible, ma'am. Kindly increase the volume of your device.
No, I am not muted. Looks like there is some internet issue, you know. It
In your
is lagging.
device,
Internet is
you may
lagging.
increase the volume, ma'am. I can hear you, but it is not audible clearly. Hello, 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 ma'am. Hello.
Can you hear me now?
Yes, I can hear you now, ma'am. Can you please increase the volume?
Okay. It is 100%. Can you hear me now?
Yes, a little bit better, ma'am. Uh, let's start. Uh, Dear all participants, we are sorry due to technical inconveniences. Uh, we are going live on YouTube, and you may join with us on YouTube and through the Zoom. The webinar is on biohazard risk management. आज बायोहैजर्ड रिस्क मैनेजमेंट में हम डिस्कस करेंगे. हमारे साथ उपस्थित हैं डॉक्टर माधवी जोशी मैडम. शी इज करेंटली दी जॉइंट डायरेक्टर कम professor at Gujarat Biotechnology Research Center, and she will be discussing on the global and national perspectives and other aspects of biohazard risk management and biohazard. Then we have another resource person, Dr. Paresh Shurati. I request you all to join with us on live link through the YouTube, and I request Dr. Madhvi ma'am to kindly start the session.
Can you see the screen?
Yes, ma'am. Can you make it full screen?
I will do that. Just a second.
Yes, ma'am.
So, is the screen visible now?
Yes, ma'am. It is visible.
Yeah, so thank you so much, the team GIDM and Dr. Bateswar Das and other faculty members for inviting me today for this very important webinar, where we are planning to discuss today about the enhancement of the biohazard risk management capacities. And we will be doing this by some of the case studies, basically. So I work basically with GBRC, Gujarat Biotechnology Research Center, which is an autonomous research center under Department of Science and Technology, Government of Gujarat. So let us start, the today's discussion. So basically, whenever you are talking about biological hazards, there are multiple types of biological hazards to be considered. And I assume that there are all, general people also who are attending, many of them, they're decision makers and administrators. So the biological hazard could come from the biological agents like bacteria, virus, parasite, fungi. The latest example is COVID-19. As you all know that bacteria and these microorganisms, they are omnipresent and not all the time they are harmful to us, but many of them, they are pathogenic. And these pathogenic bacteria and viruses, they can infect individuals, they can infect, society or even a town, or sometimes in a pandemic like COVID-19, it could infect multiple countries and multiple locations. There could be outbreaks. Then another biological hazard is a biotoxin. These are the toxins coming out of bacteria or, certain animals. For example, venom, we all know snake venoms and other. For bacterial toxins, botulinum and other toxins, which even, half a liter of that toxin is capable of destroying the entire city. Then many a times blood and blood products.
Hello.
Environmental samples. So am I audible? You can just interrupt me wherever, my
Yes,
internet
ma'am. You are
connection.
currently audible, ma'am.
Yeah. And it could be environmental specimens also, which are infected ones. So basically, scientists have classified these biological hazards into 4 risk group. So risk group 1 is basically kind of a non-pathogenic agent, which is likely not to cause any disease in healthy humans and animals. So they fall under risk group 1. So that is with a low or no individual or community risk. Risk group 2 is having a moderate individual risk, but very low community risk. And risk group 3 is the agents which have a very high individual risk and the low community risk. Like COVID-19, which was caused by SARS-CoV-2, it basically falls under risk group 3. And then risk group 4, which is basically very high risk of individual as well as community transmission. So on the basis of that, we have these categorizations of handling all the biological agents. And based on that, starting from WHO to even within India, we have Department of Biotechnology, Government of India, as well as MOEF, who are time and again defining, the guidelines for management and handling of these different risk group organisms. So these are the symbols, I mean, which are the primary used when you are talking about any biological hazard. And you would have seen many of these symbols in laboratories, in medical labs, as well as labs like biotech lab, where, this is specifically a symbol denoted for biohazard. If it is, a poisonous or a toxin substance, a harmful substance or a cancer causing agent. then these symbols are displayed for a general awareness of an individual who even does not understand a lot of biology or the science behind it. They, by the symbol, they know that this area or this particular substance is not in touch. So when you talk about biological hazards, there could be broad three classification. One is mainly, the possible hazards which are occupation related. So when you are working in certain environment, due to that environment, you are exposed to certain biological agents, and then that poses a risk of having a certain type of issues. For example, if you work in food industry, then food industry uses like cheese or bread or other agencies. So those industries, they use molds, yeast, bacteria, and many other organisms which could create, some allergies or other, toxins also sometimes they release. So what are the precautions you should be taking? Similarly, healthcare workers and those who work in the laboratory, they know that any time when an individual is ill and is coming to an healthcare system, that means a person is exposed to certain biological agents, except for cancer and cardiovascular diseases. So those infected individuals have ability to transmit that diseases to healthcare workers also. And then there are dedicated precautions required, like you need to have PPE, personal protective equipments, then safe handling of the infectious specimens, wearing gloves, covering eyes, clothing, and then after dealing with those individuals or the agents, for example, the swab sample or any other thing which is coming out of such individuals, how you discard them. So that is also the third category, which is, environmental risk coming out of these biohazard waste. So similarly, in agriculture, metal, or even, museums, libraries, all these places have different type of microorganisms which could harbor some threat. And based on, the care, like for example, measurement for reducing dust and aerosol in those environment, or maybe regularly decontaminating the spaces, could reduce the possible hazards which are associated with the workplaces. Now, specifically coming to healthcare samples, or, the laboratories like GBRC, where these biological samples are handled, one of the major risks associated is a biological spills. So for one or the other reasons, basically, you have an accident in the laboratory where you have a spillage of this high risk material. It could be anything like bacterial cultures or a body fluid coming out of a patient who is already positive for HIV. Or maybe, sometimes when veterinarians are there, for example, when they are going in the field, for example, avian influenza, or in case of anthrax, you are exposed to those agents. And how do you deal with that? So in laboratory, basically, majority of the labs, as per NABL or as per, the good laboratory practices, they have defined what type of level it falls under. So whether it falls under biosafety level 1 or 2 or 3 or 4, 3 and 4, they are very highly specialized laboratory area. And they use various instruments, for example, kind of a ready-made spill kit, or maybe, the granules for disinfection, chlorine and other, agents which are also used for frequent decontamination of the spaces. The persons working in those areas, they use PPE like gloves and aprons and other things, which make, their exposure either nil or to a minimum negligible possibilities. So basically, when you talk about laboratories approach to biological risk management, for that we need to define the scope, nature, and the timing of the assessment. And after identification of the biohazard, whether it is in laboratory or it is in environment or associated with any workplaces, then you have to determine the risk assessment process and what are the likelihood and potential severity of the consequences or the harm that is associated with the biohazard. And accordingly, and standardized repeatable risk assessment process and the risk register preparation is required, and you have to prepare the best management practices to overcome such type of the risk. So basically, when you talk about risk assessment, basically what is a risk assessment? It is a systematic process where you are gathering, assessing and documenting the information to the each level of risk. It could be retrospective also, or it could be advanced or proactive also. So it provides us with a basis for taking action and to manage and reduce the negative consequences, which can avert a lot of acute public health risk. Now, sometimes we think that management of the laboratory, how it is affected at a community level. One of the best example again is COVID, where people are thinking that this virus has escaped out of the Wuhan Institute of Virology in China, and from there it has created the havoc in the entire world. So in case of risk management cycle, you have to first identify the event. So event detection is very, very important. And once you identify the event, then you have to do the risk assessment where you have to understand what is the hazard, what is of the exposure, and the context assessment. So based on that, you have to categorize an event. And then what are the control measures to be taken? For examples, like you have to entirely shut down the area, decontaminate it, how to deal with the people who are likely to be exposed to that area, and then finally evaluation, that how ultimately you handled that particular risk. So based on that, ultimately, you are able to divine an effective strategy for the risk assessment. And it is not a one-time process. So every time, you encounter these type of different risks or the events in the place, then you have to, always change your plan and make it kind of more, robust in terms of protecting not only the people who are directly exposed to that hazard, but also the community at a large. So risk and likelihood, when you are talking about, so in case of biological hazard, basically this is a typical risk diagram. So risk is basically the product of likelihood and consequences. So for any event, you have to, every smallest of the event, you have to assess what is the likelihood and what could be the consequences. And as you move along this graph, when the likelihood and the consequences, they both increase, the risk of the entire event increases. So likelihood is basically, you have to consider what is the agent, what are the characteristics, how you handle them, what are the mitigation practices or strategies being followed. And sometimes, even by changing simpler SOPs, you could change the entire risk patterns. For example, I have been told that many of you are veterinarians over here. So when there is a bacillus anthracis diagnosis is to be done, rather than doing the isolation and culture, you could also do a PCR wherein the potential risk is very, very reduced to the person who is handling and also the fallouts of it. So such type of examples. This is another example, where a scenario is given wherein suppose you are working with a Brucella abortus, but then you are also using all the laboratory benches without the personal protective equipments which is defined. And then the cultures, they are grown in the liquid broth rather than on the culture plates. So certainly we know that this is a worst case scenario where the risk, if you are calculating, then likelihood and consequences of this particular practice resulting into a potential biohazard is a very, very high. But in the similar case, if you think that you are doing PCR, you have used inactivated samples, you are using biosafety cabinets, and you are also wearing a PPE, that means prescribing the total process, then when you are talking about that, then likelihoods are very, very less. But still, if anything can go wrong, for example, inactivation is not proper, and then anyhow accidentally there is a spillage, then consequences still could be there. Third case scenario is that you are using, for example, proper discard mechanisms for disposing the entire material that is a suspected material. So in such cases, when you follow the complete SOP, then the likelihood and consequences, they both reduce. So typically, this is MOEF, Ministry of Environment and Forest, has given us a very distinct guidelines for disposal of the bio waste. And there are several classifications of it. And for example, chemical waste pail or radioactive solid waste container. There is this biohazard waste cell. There are different types of the bags which are used for biohazard bags. For sharp containers, you have a CSA approved different, bags, and then totes are also used. So this is animal anatomical waste specifically is discarded in this type of red beans. So these guidelines are very well defined, and in all healthcare as well as the possible setups where these biological are handled, they are all being followed this. So basically, how do you mitigate the risk? So you have to anticipate the issue pre-incident. Pre-incident is the time where you have to anticipate the issue, remove or reduce, whatever the hazard, and then increase familiarity with the hazard to all the handlers. So these are, the pre-incidences that determines our likelihood factors, whether that event will happen or not. So better is your thought process or SOPs which are being followed, the likelihood will be very, very less. Now, for example, there is an incidence, then in that case, you have to look at the post incidents. Then you have to train people how to deal with such incidents. They should know what to do, what not to do, whom to report, how to, take actions, then have a backup plan, and increase protection from the hazards when there is a such. So consequences are the factors that will determine the severity of this particular incident. Now, these are the two case studies that we discussed. One is, when you are associated with any specific work group, how do you handle, and into the laboratory or healthcare conditions. Third major thing where the public at a large is being affected is, kind of epidemics or pandemics which are coming out of these biological agents. And then if we just look at the India's performance in tackling these biological emergencies, so I will discuss some of them you might also have known. For example, this Canasur forest disease. So in 1957, we basically adopted an interdisciplinary approach to tackle this disease. So along with NIV Pune, Rockefeller Foundation was also, chipped in for providing technical and financial support. So Canasur forest disease, or it is also known as monkey fever, basically, it comes from I mean, monkeys can transmit it, or it also can from human to all via, this parasite it is transferring. So till now, India has developed a major reactive approach to disease outbreak rather than developing measures to prevent such infections. So majority of the time when there is multiple agencies involved, for example, agriculture, animal husbandry, environment, public health. So at that time, you need to talk to each other, multiple agencies or departments for mitigating the risk. For example, avian influenza, this is again a bird flu which is commonly known as. So whenever there is a high density poultry population, we are vulnerable to avian influenza, and there have been multiple outbreaks in the past. So from poultry, it can also come to humans, and then human to human transmission in the community is also very well possible. And in that case, when I mean, you do not have a good measures, the current practices is involved only of the mass culling of the birds whenever such things are there. So as a policy response, I mean, there is a very good mechanism set by Government of India. We do a lot of sampling. Those samples are being sent to Bhopal, which is a national institute for declaring this type of pathogens. And then based on that, there is a declaration of a bird flu. But what happens, that there is a huge financial burden involved on the poultry farmers. Whenever, there is such outbreak, the killing of animal is the only source which is left out. And another thing is Nipah. We know that from bat it comes to pig, or maybe bat is eating the fruits, and those fruits are being taken up by humans. So again, Nipah is a BSL-4 virus. We had seen such case in Kerala. Nipah outbreak was there. And in that, basically, we worked with all the agencies like National Center for Disease Control along with the WHO. We have strategic health operation centers for monitoring these outbreaks. And with the help of that, vaccines and other development measures were also in place. So these are kind of, the systems where we could do a better management. These are another examples, like, when sometimes you have this locust attacks, which are not directly harmful to humans, but, to the crops and other things, they have a very bad impact. So in that also, I mean, we have seen such type of issues. COVID-19 pandemic, it does not require much discussions, but basically as a country, we did a very good job during COVID. And this was primarily attributed by increased diagnostic facilities for screening large populations, even from green zones. Then a very good vaccination drive, the record time India could vaccinate majority of the vulnerable population, resulting or averting people out of the casualty of the COVID-19. We had a very good law enforcement also, like initially we had lockdown restrictions on the travel and entry, and then having the containment zones. The private hospitals were also open up to anybody for getting COVID related treatment, designated COVID hospitals in private sectors as well, and disease surveillance as well as environmental surveillance. So basically, when you talk about biological safety fundamentals, you have to consider multiple factors along with the epidemiology of a particular biological hazard or organism. And at a community level, you have to think, what are the risk factors? I mean, how many people have gathered? What is, the duration of infection, or maybe what is a successful infection? So basically exposure, and then the time taken, the type of activity. So this is just a typical example in a, game where, stadium, there's a large gathering, which could result into super spreader events. So all these fundamentals are very, very important for understanding the potential risk. And finally, the gold risk control parameters. When you have such a large scale event, then there are three types of control mechanisms that you could put in place. The first one is a technical and engineering controls. For example, you have HEPA air filtration, where, the air is coming out filtered. Then you have plastic shields or one-way aisles, or there is a surgical mask, sanitization of the hand, wearing proper, these things. And then organizational and administrative controls where, you demand people for physical distance, maintaining social distance, then personal screening, uh, vaccination, encouraged vaccination. So all those things. And then finally, the human or the behavioral controls. So basically, self-identification of an individual, COVID appropriate or pandemic appropriate behaviors where, you use specific instruments so that you do not spread a particular disease to others. So these are some of, the steps and the methodology, for example, to have a full questionnaire, then do environmental scan, interview all the possible affected people, give them the training and virtual and online risk assessment processes. So we are also doing very good as a country. We have for disease surveillance, the Ministry of Health and Family Welfare has specifically created NCDC, that is National Center for Disease Control. And then under that, there is IDSP, that is Integrated Disease Surveillance Program, which has a unit at the central, state, and district level where, you are able to report such type of rare events as well as endemic and pandemic situations. So still we could, improvise on the disease surveillance in India, the strengthening of the public health infrastructure, and by putting in more money for doing a research on these type of high risk pathogens or the biohazard agents would give us a better leverage. As I told you, I work with GBRC, and in GBRC we have developed these several, disease surveillance dashboard. The first one is COVID-19 genome sequencing dashboard, wherein you can clearly see more than 13,000 genomes we have sequenced, starting from the second, genome that we released early in the April 2020. Then we are also involved into the wastewater surveillance of COVID-19. This work is also referenced by WHO in their guidelines. And this is another, network program on antimicrobial resistance, superbugs, and One Health. So these type of surveillance mechanisms could also be developed and put it in a dashboard system. One of the important thing to, address this biohazard risk mitigation is, in the beginning of my talk, I explained to have the various biosafety level laboratories. And currently, if you look at, India, NIV Pune is the only functional BSL-4 laboratory. Nishad and ICFMD, they are all BSL-3 and ABSL-3 facilities. So there is a high requirement, in a country which is more than 140 billion people. You need to have a place where these type of high risk pathogens are studied. So this is a typical example of a BSL-4 laboratory where, the entire air that comes in and goes out of the system is fully sterilized. So there are multiple biosafety levels, as I told you, from BSL 1, 2, and 3. And these type of BSL-4 laboratories, they are very secured area where you could work in a negative pressure. That's a very high negative pressure, up to minus 300 to 400 pascals, where no pathogen, not even a virus, can escape outside of the facility. And these are some of the, work examples I've taken from the Robert Koch Institute, how a typical BSL-4 workflow looks like, where over a normal PPE, you have these pressure suits where negative pressure, because you're working in negative pressure. So to bear with that, you have to wear this pressure suits and then, work into this environment. And while coming out, it is a typical process of chemical shower followed by, full body shower to ensure that you are not having any exposure to this high pathogenic organism. Globally, if you talk about, there are 69 these maximum containment laboratories, the BSL-4 laboratories. And as you can see that majority of them, they are clustered in the European region as well as, in US region. So in India, currently we have a functional BSL-4, that is NIV Pune. In Gwalior, one laboratory is in construction by DRDO, and GBRC in Gujarat is also developing one such laboratory. So this is just, you can see that country wise, if you just look at uh, how many BSL-4 labs are there per billion of the population, and you can see that we have a very negligible stand over here, and that creates a need for developing such biosafety level labs. Also, as a part of the Atmanirbhar Bharat, Prime Minister Shri Narendra Modi ji has also said that uh, four such new laboratories will be, developed. And GBRC is, as I told you, is developing one such BSL-4 laboratory. So we are developing this facility in Gandhinagar. It is envisaged to have a BSL-4 lab where you can deal with the human or animal origin viruses, and then various modules of BSL-3, including ABSL-3, where you could conduct trials of the vaccine and all. This is a very, very prestigious project of a state government at the cost of rupees 225 crore. And government has already given a land near Pethapur, and hopefully within 2 years, this laboratory will be ready for the use to the service of the community. So with this, I thank all of you for those who have joined online as well as those who are present here. And once again, thank you to organizers for giving me this opportunity to talk and discuss.
Hello.
Yeah.
Thank you, ma'am. Thank you for insightful discussion on the biohazard risk management and necessary activities and awareness. I request the participants to quickly put forward your questions. We are live on YouTube. हम YouTube में live हैं. आप हमारे साथ YouTube में live जुड़ सकते हैं. Live link already chat box में दे दिया गया है Zoom में, and group में भी share कर दिया गया है. जो भी हमारे साथ लाइव देख रहे हैं, काइंडली शेयर द लाइव यूट्यूब लिंक among your colleagues and concerned officials. आप अपने concerned officials and respected colleagues के साथ इस लिंक को शेयर कीजिए. बायोहैजार्ड एक महत्वपूर्ण विषय है एंड बायोटेररिज्म एक ग्लोबल कंसर्न है आज के टाइम पे. कुछ ही दिन पहले कोविड है ग्लोबली हमें इम्पैक्ट किया है, बट कोविड के अलावा और भी सारे बायोहैजार्ड रिस्क है जिसके बारे में हमें अवेयर होना चाहिए, एंड उसी के ऊपर फर्स्ट सेशन थे. थैंक यू डॉक्टर माधवी जोशी टू जॉइनिंग विद अस, एंड रिक्वेस्ट द पार्टिसिपेंट्स, सारे पार्टिसिपेंट्स को रिक्वेस्ट किया जाता है कि आप काइंडली अपना क्वेश्चन पुट फॉरवर्ड कीजिए. मैम हमारे पास एक क्वेश्चन है यूट्यूब में. हेलो.
Yeah, I am here. Please go ahead.
One respected participant is asking, what are the individual level steps and actions that we can take during biohazard and in part of preparedness.
So, yeah, that's a very relevant question. So, at an individual level, we have all experienced a very recent COVID-19 pandemic. And we coined a new terminology, rather, COVID appropriate behavior. So that is one pathogen which was, say, for example, transmitting through a aerosol from one individual to another individual. But initially, we thought that it is being transferred through air. So aerosol and air. So when there is, when you know that, okay, this is the agent which is posing a threat, then you could devise, appropriate strategies. For example, during COVID, we were maintaining social distance with the, other public. Then we were sanitizing our hands and, the exposed body parts frequently, so that we are avoiding the contact. One of the most important thing for an individual to follow is that even if you have the slightest of the thought process or a chance that if you are exposed to that particular agent, so in that case, probably the best thing you can do is to isolate yourself, so that at least your family members, close family members, and the society and other people are protected. So again, it depends. Sometimes you can even not detect that you are exposed to an biological agent, and after a particular incident has happened, then only you will be able to know that, okay, this is the issue, and I could have encountered this particular pathogen. So, but always, I mean, the basic hygiene practices are very, very important. If you're visiting hospitals or, such area where there are chances or high chances of transmission, you need to take appropriate measures.
Thank you, ma'am. Definitely, we need to take appropriate actions. We have another question, ma'am, on YouTube.
Hmm.
How to discard sugar strip?
Yeah, so that's a very good question. In Gujarat is a capital of diabetes, and every household, you have this blood testing devices, at home where you are checking, say, fasting or random blood sugars. And those strips, although if you look at those strips, so they are always one-way strips. So there are not, very high chances that any other secondary organisms, like HIV or HCV or other could come out of it and infect and third individual. Always ideal thing is to discard it as a biological waste or a biohazard waste. So sometimes you can follow that, like you could store it in a special Ziploc containers away from children. And whenever you are visiting any healthcare setups or laboratories, you could give it to them, because they are the one who are regularly disposing the biohazards. So this is an ideal situation, but many a times it ends up in our regular dump yards. Not only these trips, many other things also. But we have to take appropriate care and measure.
Similar question, ma'am, for ECG lead. How to discard the same?
Sorry,
ECG lead. How to discard the ECG lead? Someone is asking.
which lead?
ECG lead.
Sorry, I'm not able to hear you properly.
Yes, ma'am. On in the chat box, I am typing ECG lead. Echocardio. Hello. Hello, ma'am.
Hello.
Yeah, echocardiographic lead
So
echocardio.
echocardiogram electrode stickers you are asking.
Yeah, yeah.
Yeah, those are not potentially exposed to any body fluids, other than maximum sweat, because they are all topical applications. So those can be discarded in the regular bins.
Yes, ma'am. Thank you. Ma'am, biomedical waste management concerned official is asking what is suitable bag and what is suitable color of the bag that should be used for biomedical waste management.
So typically, MOEF has given a very detailed and elaborate color coding system for the waste management. Specifically, if you go to the hospitals and any other laboratory, so we usually follow 4 beam systems, right? So we have got red bags, blue bags, yellow bags, and normal black bags for discarding paper and all. And whatever possible infected material is there, that all goes into typically yellow bag, where it is blood or any blood products, or any potential biohazard related material is there. Similarly, you have to properly put that in a bag and then cover it. In laboratory, we also follow a protocol of autoclaving. So even before giving it away to, say, a waste management company, for example, GPCB, Gujarat Pollution Control Board, has designated different this biomedical waste collector companies across Gujarat in different area, and they regularly visit these hospitals and healthcare setups, and they collect different categories of the waste, and then they take it back to their facility and then they dispose it there. So in such condition, you have to basically understand a proper classification system. For example, microbiology, you have media and other thing coming out, or sometimes the organism is there. So
चाहिए
that
चालू
hello.
Yes,
आप
ma'am.
बताइए
Yes. Hello.
Yes. So according to these MOEF rules, you have to classify the waste. It is very clearly given in short, and then discard it.
Yes, ma'am. Thank you. Yeah, definitely very relevant questions and sort of good discussion that we have done with Dr. Madhvi Joshi. Thank you, ma'am, again to joining with us and providing us with your insightful knowledge regarding the subject. I quickly now introduce Dr. Paresh Shurati for our next session. The session is focusing on intersectoral coordination mainly for biohazard risk management. Dr. Paresh Shurati is from Health Department, Epidemic Branch, Rajkot specifically. एंड हम अब डिस्कस करेंगे कि इंटर सेक्टरल डिफरेंट जो सेक्टर्स है बायोहजार्ड रिस्क मैनेजमेंट के लिए. तो डॉक्टर परेश शुराती विल डिस्कस ऑन दैट ओनली मेनली नाउ. सो ओवर टू यू डॉक्टर परेश शुराती.
Thank you to Gujarat Institute of Disaster Management for inviting me for this lectures. I'm ready regarding the biohazard risk management and for the public health safety. उसके रिगार्डिंग मैंने एक पीपीटी रेडी की है, तो मेरे ख्याल से वो आपको मैं अभी शेयर कर रहा हूँ.
Yes, are you sharing the PPT, sir? Hello.
Yes.
Okay.
Hello.
Yes.
Biohazard risk management for the public health safety. So what is
Oh,
the
your PPT is not visible.
બરાબર.
okay?
Hello.
એકાદ અવસ્થા નથી ભરાયા કદાચ.
Please
Is it
open
okay?
the PPT, sir.
Okay. So biohazard risk management for the public health safety is the main part is ensuring the safety of the healthcare
PPT is
facilities.
not visible.
What, sir?
The PPT you are sharing is not visible. Only the
Okay.
home page, your home page is visible.
Okay, sir.
Can you please open the PPT and then share the screen?
Okay, I'm doing like that.
Hello, are you connected, sir?
Yes, yes.
Yes.
Is it seen? Is it there?
Yes, yes. Kindly make it full slide, sir.
Okay. Is it
Thank you.
okay? Okay. Thank you so much. Biohazard risk management for the public health safety. मेरे ख्याल से ये टॉपिक सभी को बहुत अच्छे से कवर करता है. आई थिंक द टारगेट ऑडियंस इज एवरीवन. दुनिया के जितने भी लोग हैं वो सब लोग ये बायोहैजार्ड रिस्क मैनेजमेंट और पब्लिक हेल्थ सेफ्टी के वो टारगेट ऑडियंस है ही. तो सबसे पहली बात तो ये है कि एंश्योरिंग द सेफ्टी ऑफ द हेल्थ केयर फैसिलिटीज. इसके लिए इसके लिए बायोहैजार्ड्स का जानना बहुत जरूरी है. बायोहैजार्ड रिस्क एंड एनवायरमेंटल मीन्स. तो मैं आज आपको इतनी इतनी चीजें थोड़ा सा रूल्स रेगुलेशन स्पेसिफिक मैनेजमेंट इसके अंदर थोड़ा आपको दिखाऊंगा. तो व्हाट इज अ बायोहैजार्ड रिस्क? A biohazard risk or biohazard is a biological substance that poses a threat to health of living organisms, primarily human. This could including a sample of microorganism, virus, toxin that can adversely affect to human health. A biohazard could also be a substance harmful to the other living. ये बायोहैजार्ड्स में सब्सटेंस जितने भी है, जितने भी वो थ्रेट्स है, वो प्राइमरीली ह्यूमन को ही अफेक्ट करते हैं. उसके अलावा अगर हम इसके टाइप्स के बारे में थोड़ा सा बात करें, टाइप्स ऑफ मेडिकल वेस्ट, तो कितने कितने टाइप्स के वेस्ट होते हैं. तो नॉन इन्फेक्शियस, इन्फेक्शियस एंड हैजार्डियस, तीन तरह के मेडिकल वेस्ट जनरेट होते हैं. नॉन इन्फेक्शियस में पेपर फ्रॉम द ऑफिस, ग्लासेस, मेटल, प्लास्टिक पैकेज, फूड वेस्ट, ये सब नॉन इन्फेक्शियस आता है. इन्फेक्शियस के अंदर ब्लड प्रोडक्ट, पैथोलॉजिकल वेस्ट, सार, कल्चर, stock of the infectious agent, contaminated equipments, isolation waste, glassware, ये सब infectious में आता है. और hazardous में बहुत से hazardous जैसे toxic chemical, waste anesthetic gases और formulated cytotoxic chemicals, जितने भी chemicals है वो hazardous में आते हैं. उसकी एक कैटेगरी बनाई गई है, वेस्ट कैटेगरी. तो कैसे कैसे ये सारे वेस्ट को कैटेगराइजेशन करते हैं. तो कैटेगरी 1 में ह्यूमन एनाटॉमिकल वेस्ट जो होते हैं वो आते हैं, और उसकी ट्रीटमेंट हम उसको डीप बर्न करके या इंसेमिनेशन करके उसको जला के हम कर सकते हैं. ह्यूमन एनाटॉमिकल वेस्ट को डीप बर्न करके हम उसको ट्रीटमेंट डिस्पोजेबल कर सकते हैं. कैटेगरी 2 में एनिमल वेस्ट आते हैं, उसको भी सेम ट्रीटमेंट हम दे सकते हैं. कैटेगरी 3 में माइक्रोबायोलॉजी और बायोटेक्नोलॉजी वेस्ट होते हैं, जिसको लोकल ऑटोक्लेविंग और माइक्रोवेविंग करके हम उसको कर सकते हैं. कैटेगरी 4 के अंदर वेस्ट शार्प्स होते हैं, उसको डिसइंफेक्ट करके हम उसको आगे ट्रीटमेंट दे सकते हैं. कैटेगरी 5 के अंदर डिस्कार्ड और मेडिसिन, साइटोटॉक्सिक ड्रग्स, ये सब होते हैं. इन सब के लिए भी ट्रीटमेंट्स अवेलेबल हैं. इंसर्मिशन डिस्ट्रक्शन, ड्रग्स डिस्पोजल इन सिक्योर्ड लैंडफिल्स, ये सब करके हम इसको ट्रीटमेंट डिस्पोजेबल कर सकते हैं. कैटेगरी 6 के अंदर सॉलिड वेस्ट आते हैं. सॉलिड वेस्ट के अंदर भी अलग अलग कैटेगराइजेशन की ट्रीटमेंट डिस्पोजेबल है. इसके अलावा लिक्विड वेस्ट, जितने भी लिक्विड वेस्ट है उसको भी डिसइंफेक्शन बाय द केमिकल ट्रीटमेंट करके उसको लिक्विड वेस्ट को डिसइंफेक्शन कर सकते हैं. कैटेगरी 9 के अंदर इंसरिनेशन एसिड्स, जितने भी धुएं हैं, जितने भी वो है, उसको भी डिस्पोज करने के लिए म्युनिसिपल कॉर्पोरेशन की लैंडफिल होती है. उसके अलावा केमिकल वेस्ट होते हैं, केमिकल ट्रीटमेंट एंड डिस्चार्ज करके उसके लिए भी एक अलग से लैंडफिल बनाई गई है. तो ये है वेस्ट की कैटेगरी और उसकी ट्रीटमेंट एंड डिस्पोजेबल. ये आप सबको बहुत इंपॉर्टेंट रहेगा. ये चार्ट में आप सबसे विनोद करूंगा कि इसी तरह से ये ट्रीटमेंट और डिस्पोजेबल करें. क्वांटम ऑफ मेडिकल वेस्ट की बात करें तो हॉस्पिटल वेस्ट जनरेटेड इन डेवलपिंग कंट्रीज पर पेशेंट इन much less in compared to volume generated by the developed country. तो हमारे यहाँ पे सबसे ज्यादा वो बायोमेडिकल वेस्ट का जनरेशन बहुत ज्यादा होता है. सबसे बात करें तो 1 to 3 kg per day per bed is compared to 5 to 8 kg per day per bed in developed countries. So हमारे यहाँ एक बेड के अंदर पर डे की 5 to 8 kg का वेस्ट जनरेशन होता है. इसके अलावा उसकी मैनेजमेंट की बात करें तो मैनेजमेंट ऑफ बायोहैजार्ड रिस्क की बात करें तो कैसे उसको मैनेज कर सकते हैं। तो मैनेजमेंट करने के लिए हमारे पास सबसे पहले जानना चाहिए कि आइडेंटिफाई दी आइडेंटिफिकेशन होना चाहिए और उसका मिटिगेशन ऑफ रिस्क, ये हमारा सबसे पहला गोल होना चाहिए। सो बायोसेफ्टी के गाइडलाइन में भी ये सबसे पहला हमारा गोल है कि आइडेंटिफाई एंड मिटिगेट द रिस्क, ये सबसे पहला हमारा असेसमेंट गाइडलाइन में लिखा हुआ है। उसके अलावा हमारी गाइडलाइन में ये भी लिखा हुआ है सेफ गार्डिंग द हेल्थ एंड सेफ्टी ऑफ लैब पर्सन, preventing the accidental release or contamination of the research samples, the demonstration of the delegates and complaints, ये सारी बातें मैनेजमेंट में आती है। तो मेरा ये मानना है कि जिस तरह से ये मैनेजमेंट करेंगे तो सबसे से अच्छे हम हेल्थ को सुधार सकते हैं। उसमें सबसे ज्यादा किसको, विच इज द टारगेट ऑडियंस, तो रोल ऑफ द फ्रंट लाइन वर्कर का सबसे ज्यादा रहा है। तो WHO ने डिक्लेयर किया है कि डेवलप कंट्री के लिए एक गाइडलाइंस दी है जिसमें उन्होंने ऐसा लिखा है कि पर्सनल प्रोटेक्टिव इक्विपमेंट्स, डिकंटामिनेशन प्रोसीजर, इन्फेक्शन कंट्रोल, बायोसेफ्टी, बायोसिक्योरिटी, ये सारी चीजें जो है वो रोल ऑफ फ्रंटलाइन वर्कर का है। तो उसके अलावा हम रिस्क असेसमेंट और रिस्क मैनेजमेंट की बात करें तो पैथोजेंस, प्रोसीजर्स, पर्सनल इक्विपमेंट्स, प्रैक्टिसेस, प्रोटेक्टिव इक्विपमेंट्स एंड प्लेस, ये सब रिस्क मैनेजमेंट कर सकते हैं। इसके अलावा हम बात करेंगे व्हाट इज हु आर WHO ने जो डिक्लेयर किया है उसकी बात करेंगे। WHO ने हमें ये बताया है कि रिस्क ग्रुप 1 कौन सा है, रिस्क ग्रुप 2 कौन सा है, रिस्क ग्रुप 3, रिस्क ग्रुप 4 कौन सा है। तो रिस्क ग्रुप 1 की बात करें तो माइक्रो ऑर्गेनिज्म that is unlikely to cause a human disease or animal disease. रिस्क ग्रुप 2 की बात करें तो moderate individual risks or low community risks or pathogens that can cause a human or animal disease but is unlikely to be serious hazards to the laboratory worker, the community, livestock or the environmental. Laboratory exposure may cause the serious infection but effective treatment and preventive measurement are available in the risks of the spread of the infection is limited. So this is a risk group 2. Now we are talking about the risk group 3 as per discussed by the World Health Organization. The high individual risks and low community risks of pathogen that can usually causes a serious human or animal disease but does not ordinarily spread from the one individual to another. Effective treatment and preventive measurements. Now the COVID and everything is comes under the risk group 3 and risk group 4. WHO risk group 4 is saying like that the high individual and community risks, a pathogen that usually causes a serious human or the animal disease and that can be readily transmitted from the one individual to another, directly or indirectly. Effective treatments and preventive measurement are not usually available. So this is the high risk group 4, which is the high individual and community risks, just like the corona. Now, what is the steps we have to take? One of the reduce, reuse, and recycle. These 3 steps are major important in the biohazard risk management for the public health safety. Reduce, reuse, and recycle. Waste management minimization done by the segregation, source reduction. The source reduction is the highest important for the hospitals. Resource recovery and recycling, and education. So education, the training for the role of the any frontline worker, the healthcare worker, most important is the educations and training. Another important is pursuing the practices, how the behavior change communications and pursuing practices will lead to the waste minimization. Now discussing regarding the regulatory framework in India. In India, there was no legislation on medical waste till the MOEF proposed for the first draft in 1995. The second draft rule were notified in 1997. The final rule were notified on 20 July 1998 and were called the Biomedical Waste and Management and Handling Rules 1998. These rules were enacted under the EPA 1986. So this is the final enacted under the EPA 1986. The rules have specified in 3 bin systems for the segregation waste: yellow bin, blue bin, and puncture-proof container. This is the 3 bins are discussed by the authority. Biomedical Waste Rule 1998, the silent features. The rule applied to all persons who generated the collected, received, transport, treat, and dispose the store or the handle the biomedical waste in any form. This is the silent features. It is a duty of the occupier where they require to set up the requested biomedical waste treatment facility for the treatment of the waste or ensuring the requesting treatment of the waste as a common waste treatment facility. So this is the first rules by the biomedical waste 1998. Biomedical waste is to be treated and disposed in accordance with a Schedule 1. Biomedical waste has to be segregated as a point of generation before the storage, transportation, treatment, and disposal. No untreated biomedical waste can be kept beyond the period of 48 hours. So this is too much important. So the 48 hour is maximum limit for the untreated biomedical waste. Prescribe authority, authorization, advisory committee, annual report, maintenance of the record, accident of report, and apply. Now another management is specific guideline for the handling the SARPs. So किस तरह से SARP को मैनेजमेंट कर सकते हैं? The rules of categorization SARP is category for number 4. SARPs are defined as a comparison of needle, syringe, scalpel, blade, glasses, anything that may be caused puncture and cuts. This may including both used and unused SARPs. This is the definition of SARP. Now the segregation and storage. The types of container prescribed for the waste SARPs have to be puncture proof and can be blue, white, and translucent in color. So this is a definition and this is a segregation policy. Now what is the treatment? Treatment, that is a chemical treatment, autoclaving, rotoclave, microwaving, and some of the disposables are mandated to prevent any unauthorized or reuse. This is very important. It is mandatory to prevent any unauthorized or reuse. Final disposable after disinfection or after disinfection and multiplication of SARP, they should be disposed in secured landfill as per the rule. As secured landfill are not available everywhere, alternate system recommended including the SARP pits. This is the alternatives as per the WHO 2005 saying in the source. The poster is saying that SARP pits are proposed to dispose in this like way. Pit can be dug and lined with a brick and mandatory to pit to cover with a heavy concentrated slab. So this is a as per the guideline of WHO 2005 that should be covered with a heavy concentrated slabs. Now another thing is the drum and how to discard the safe management for the waste for the healthcare activities as per the WHO 1998 discussed, that is for the encapsulation. For this we have to dispose it in the landfill sites. Now the precaution for the handling of the medical waste. These all are the precaution. Never transfer the SARP directly from person to person. This is the first precaution. We should learn from this practice only. Another thing is never recap the needles. बार बार उसको recap नहीं करना चाहिए. Another thing is never overload bins used for storing biomedical waste. Never overload. कई बार बहुत हॉस्पिटलों में बहुत ओवरलोड हो जाता है, तो नेवर ओवरलोड द बीन्स फॉर यूजिंग द बायोमेडिकल वेस्ट. नेवर इनहेलेट. डू नॉट इनहेलेट द केमिकल डायरेक्टली. यूज ऑलवेज मास्क. उसको इनहेलेट नहीं करना चाहिए डायरेक्टली, मास्क को पहनना चाहिए. ये प्रिकॉशन है फॉर हैंडलिंग ऑफ मेडिकल वेस्ट. और सबसे इम्पोर्टेंट बच्चों से ये सारी पण शार्प चीजें है, कीप अवे शार्प मेडिसिन फ्रॉम द चिल्ड्रंस. So these are the precautions for handling the. Now the treatment of the technology for the medical waste. Now treatment, the most common method is the temperature. उसको एक particular temperature 60,000 Fahrenheit से 25,000 Fahrenheit या फिर 871 सेल्सियस से 1371 सेल्सियस तक उसको टेम्परेचर करें. Over 19 of infection waste is often burned in incineration. Advantage, what is the advantage? Reduce landfall cost, reduce the overall energy cost. So this is the advantage for the biomedical waste. Disadvantage is emitted toxin air pollutants in incineration as potentially hazardous. Health impacts or of incineration. Now the steam sanitization carried out in device called autoclave. Autoclave is everyone known by the hospital staff. Process taking to 30 to 90 minutes. Temperature is 30 to 90, 190 Celsius. Volume reduced by 75%. Reduce can be landfill. Residues can be landfill. Used for the low radioactivity chemical pathogenical waste. Now I want to show you some photographs of dry heat in disinfectants and chemical disinfectants, microwave disinfectants. This is an hydroclave disinfectants. So now go for the different photographs for the rotoclave. I think rotoclave is a process is fully automatic moderatization version of autoclave. Sterilizing agent is a water vapor in a rotating pressure chamber used for the laboratory waste, bedding material, and animal waste. Some of the photographs of biomedical hazard waste management. Vermiculite deep burying earthworms, the only alternative that holds the promise for the waste disposal, seems to be ignoring back to Mother Earth. Now the conclusion is, with newer disease attacking the humankind, it's remembered to part of the medical fertility to ensure the hospital don't become breeding of ground for the infections. So इसमें बहुत क्लियर कट बताया है कि कोई भी हॉस्पिटल कोई इन्फेक्शंस का ब्रीडिंग प्लेस ना बने. Awareness and sensitization at all level through the education, training, and international communication are must. This is the conclusion for my side. My reference book is Environmental Treatment Technology for the Hazardous and Medical Waste by Subhijit Datta. And another so many internet websites are available. I'm sharing the photographs and everything with you. Thank you.
थैंक यू डॉक्टर परेश शुराती फॉर ज्वाइनिंग विद अस, हमारे साथ जुड़ने के लिए. काफ़ी इंसाइटफुल सेशन था. पार्टिसिपेंट्स को रिक्वेस्ट किया जाता है कि कमेंट बॉक्स में प्लीज़ अपना क्वेश्चन पूछिए सर से. एंड सर हमारे साथ आज जुड़े हैं इंटरसेक्टरल कोऑर्डिनेशन के बारे में बात करने के लिए. सर ने काफ़ी अच्छे से बताया कि बायो वेस्ट मेडिकल एंड होम डिपार्टमेंट रिस्पॉन्स टीम कैसे एक साथ काम कर सकते हैं इस मामले में. सर एक सवाल है. सर
Yes, sir. Yes, sir.
यस, एक सवाल है यूट्यूब में कि ड्यूरिंग अनसर्टेनिटीज, क्योंकि बायोहैजार्ड कभी कभी अनसर्टेन होते हैं, अनप्रेसिडेंटेड होते हैं जैसे कोविड, तो पहले से प्रिपेयर्डनेस कम होती है. इस टाइम पे इंटरसेक्टरल कोऑर्डिनेशन कैसे हो सकता है? कैसे हेल्थ डिपार्टमेंट और म्यूनिसिपैलिटी के बाकी डिपार्टमेंट या बायो वेस्ट मेडिकल डिपार्टमेंट कैसे एक साथ एक प्लेटफॉर्म में आके काम कर सकते हैं?
दिस इज ऑल कम एट द एक्शन प्लान. एक्शन प्लान पहले से बना रहता है सभी डिपार्टमेंट का और प्रिपेयर्डनेस बनी रहती है सभी डिपार्टमेंट की. तो प्रिपेयर्डनेस के थ्रू 3 मंथली मीटिंग रहती है सभी डिपार्टमेंट की, इंटर सेक्टरल डिपार्टमेंट। आई एम बिलोंगिंग टू आईडीएसपी। आईडीएसपी में भी हर 3 महीने हमारी एक मीटिंग रहती है कलेक्टर सर के साथ, सभी डिपार्टमेंट के साथ। सो उसमें प्रिपेयर्डनेस के थ्रू सारे जितने भी न्यू डिजीज है, न्यू उसके रिगार्डिंग बातें डिस्कस होती है और उसके प्रिवेंशन उसमें डिस्कस होते हैं। सो मेरे ख्याल से प्रिपेयर्डनेस के लिए ये मीटिंग, इंटर सेक्टरल मीटिंग बहुत इंपॉर्टेंट है। और उसके अलावा हमारी अलग अलग डिपार्टमेंट से जूम मीटिंग्स भी होती है, तो वो भी बहुत इंपॉर्टेंट है प्रिपेयर्डनेस के थ्रू। जैसे ये कोविड आया तो कोविड में उसके लिए सारी प्रिपेयर्डनेस जब पहले से स्टार्ट सारे डिपार्टमेंट की थी वैसे, पर सब जब इंटरसेक्टरल सारे डिपार्टमेंट इंटीग्रेट हो गए ये इसको उसका कंट्रोलिंग करने के लिए, तो हम सक्सेसफुली उसमें टीम वर्क से काम कर सके। सो टीम वर्क इज मस्ट इन एनी वे। श्योर श्योर श्योर।
थैंक यू सर। हर एक डिपार्टमेंट में प्लान बने रहते हैं, प्लान में भी कोऑर्डिनेशन का एक पार्ट होता है जरूर। थैंक यू। हम यूट्यूब में कमेंट बॉक्स में एक फीडबैक लिंक शेयर किए हैं, जूम में भी हम फीडबैक लिंक शेयर करते हैं कमेंट बॉक्स में। आप काइंडली उस गूगल फॉर्म को ओपन करके, 1 मिनट भी नहीं लगती, उस फॉर्म को ओपन करके आप काइंडली हमें बताइए कि कैसा है ये प्रोग्राम, कुछ क्या जानकारी मिली नया, या फिर क्या सजेशंस रहेगा इसके लिए, किसको इस प्रोग्राम को हम किस तरह से बेहतर बना सकते हैं। काइंडली वो गूगल फॉर्म ओपन करके आप अपना फीडबैक दीजिए, एंड कमेंट बॉक्स में आप बता सकते हैं कि ये प्रोग्राम कैसा लगा आपको, कैसा रहा प्रोग्राम। मीनवाइल सर, एक और सवाल है
यस सर।
डॉक्टर परेश शुराती।
यस।
क्लाइमेट चेंज अनसर्टेन बन गया, क्लाइमेट चेंज रिस्क बढ़ रहे हैं, ऐसे में बायोहैजर्ड रिस्क कितना बढ़ रहा है? बायोहैजर्ड एंड क्लाइमेट चेंज में क्या रिस्क का कनेक्शन दिखते हैं आप?
Yes, sir. This is a really important question. Now the climate change is worldwide question. क्लाइमेट चेंज के थ्रू बायोहैजार्ड्स में भी सबसे कनेक्शन है ही। सबसे ज्यादा क्लाइमेट चेंज के जब जब होगा तब तब सारे रिस्क ग्रुप्स, जिसमें बच्चे, बूढ़े, जवान, सारे लोग उसमें अफेक्ट होंगे जैसे जैसे क्लाइमेट चेंज होगा। तो टारगेट ऑडियंस इज फिक्स। सो कि बच्चों से लेके सब में ये क्लाइमेट चेंज ह्यूमंस को अफेक्ट होगा। नाउ द बायोहैजार्ड्स की बात करें तो जैसे जैसे क्लाइमेट चेंज होगा तो डिस्पोजेबल जितने भी है, प्लेसेस है, साइट है, वो सारे भी हमारे पास बहुत इतने कम रह जाएंगे जितने जैसे क्लाइमेट चेंज हो जाएगा। तो द रिस्क ऑफ और द मोड ऑफ इन्फेक्शंस, डोज ऑफ इन्फेक्शंस, वो सारी चीजें धीरे धीरे बढ़ेगी। तो उसके लिए पहले से पर्सनल प्रोटेक्टिव इक्विपमेंट्स, सेफ्टी हमें सभी को समझानी पड़ेगी कि कोई और नया डिजीज लेबोरेटरी में बन के ना आए। इसके लिए हमें बहुत जरूरी है कि पर्सनल इक्विपमेंट्स और पर्सनल सेफ्टी रखना बहुत जरूरी है। तो मेरे ख्याल से क्लाइमेट जैसे जैसे ही चेंज होगा तो हम सबको बायोहैजार्ड्स के ये सारे भी नॉलेज होनी चाहिए, even not even though for the medical purpose, for the even any common man should know about the generation, transportation, treatment, recycle, सभी चीजें का नॉलेज कॉमन पीपल, हर एक डिपार्टमेंट, हर एक इंडस्ट्री, हर एक लोगों को होना चाहिए। इंडस्ट्री के पीपल्स को सबसे ज्यादा ये सब का नॉलेज होना चाहिए। केमिकल्स के रिगार्डिंग जितनी भी कंपनियां हैं, जितने भी लोग फैक्ट्रीज में काम कर रहे हैं, मिल में काम कर रहे हैं, हॉस्पिटल में काम कर रहे हैं, ये सभी को जैसे जैसे क्लाइमेट चेंज होगा तो उन सबको भी डिस्पोजेबल का क्वेश्चन आएगा और उसके लिए उन सबको पहले से एजुकेट होना बहुत जरूरी है। सो एजुकेशन इज मस्ट इन ईच कैटेगरी। एंड अनदर थिंग इज द ट्रेनिंग ऑफ ईच कैटेगराइजेशन, जितने भी लोग हैं, जितने भी अलग अलग पार्टिसिपेंट्स हैं यहाँ के जितने भी, तो उन सबको मैं रिक्वेस्ट करूंगा कि सबको बायोहैजार्ड्स के रिगार्डिंग जितने भी रिस्क असेसमेंट है वो उनको जानकारी दे, ताकि वो फ्यूचर में आने वाले क्लाइमेट से बच सके।
थैंक यू डॉक्टर परेश,
Yes, sir.
काफी
Yes, sir.
इंसाइटफुल सेशन। हमारे पास एक और सवाल है। सवाल से पहले बता दूं कि हमारा जो रिसोर्स मटेरियल है, पीपीटी, सब कुछ हम एक गूगल ड्राइव में रखते हैं। आप उस गूगल ड्राइव के लिंक को ओपन करके एक्सेस कर सकते हैं। वो ओपन टू ऑल होता है लिंक। एंड कमेंट बॉक्स में, यूट्यूब में एंड जूम में, दोनों में ही हम वो लिंक शेयर कर चुके हैं। आप आपके जानकारी के लिए बता दें कि सारे रिसोर्स मटेरियल वहीं पे अवेलेबल होते हैं। आप उसको ओपन करके डाउनलोड कर सकते हैं एंड अपने फर्दर इंफॉर्मेशन के लिए उसको देख सकते हैं। मेनुअल एक और सवाल है यूट्यूब में टू डॉक्टर परेश शुराती,
Yes, sir.
दैट हम प्लान के बारे में बात कर रहे हैं, हम क्लाइमेट चेंज एंड रिस्क के बारे में बात कर रहे हैं, हम टारगेट ऑडियंस फिक्स कर रहे हैं। बट क्या टारगेट ऑडियंस हमेशा फिक्स रहता है, ये लिमिटेड रहता है? अगर नहीं रहता है तो इन दैट केस वो एक अनसर्टेन रिस्क बन जाता है कि कौन कौन अफेक्टेड होने वाले हैं। इन दैट केस प्रिपेयर्डनेस किस तरह से हम कर सकते हैं फॉर क्विक रिस्पॉन्स स्पेसिफिकली?
For the quick response, yes. Basically, the हमारे टारगेट ऑडियंस जब हमें पता चल गई है, जब ऑडियंस को पता है कि इतने इतने लोगों को हार्मफुल होगा, जैसे जैसे क्लाइमेट्स में चेंजेस हो गए, जैसे जैसे रिस्क ज़्यादा बढ़ेगा, तो क्विक ऐसे सबसे ज़्यादा क्विक ये रखना चाहिए कि होम से, जैसे ही घर के अंदर ही सब लोगों को पता होना चाहिए कि अपने यहाँ पे कितनी कितनी सेफ्टी प्रिकॉशंस होना चाहिए, जैसे कि मास्क, हैंड ग्लोव्स, ये सारी चीजें। उसके अलावा द अनदर थिंग इज द क्विक मेडिसिन, ये सारी चीजें पर्सनली अपने घर पे रखनी चाहिए। जैसे बच्चों के लिए सारी मेडिसिन होनी चाहिए, बड़ों के लिए वो सारी मेडिसिन का एक इमरजेंसी स्टॉक हमारे यहाँ पे हमारे पास होना चाहिए एज अ क्विक रिस्पॉन्डर, एज अ प्रिपेयर्डनेस पार्ट। ये सारी चीजें हमारे पास पहले से होनी चाहिए। दूसरा कि हमारे पास ये सब पर्सनल प्रोटेक्टिव इक्विपमेंट्स भी है, ये सब भी है, तो हमें सिखाना भी चाहिए कि भाई ये मास्क को अच्छे से कैसे पहन सकते हैं, हम हैंड ग्लोव्स को कैसे अच्छे से पहन सकते हैं। सो हमारे पास चीजें हैं, पर उसका भी फिर नॉलेज होना चाहिए कि इसको कैसे अच्छे से हम ये टाइम पे पहने। जैसे कि धूप में जाना है, तो बहुत से लोग तो कोई भी चीज, वैसे जैसे जैसे क्लाइमेट बहुत ज्यादा बढ़ेगी, या फिर बहुत ज्यादा ठंडी होगी, या फिर एक्सट्रीम लेवल पे हीट, एक्सट्रीम लेवल पे कोल्ड, एक्सट्रीम लेवल पे बारिश, ये सारी चीजें जब होने लगेगी, तो हमारे पास उसके बचने का नॉलेज पहले होना चाहिए। जैसे कि एक्सट्रीम हीट है तो हमें सन क्रीम लगा के ही जाना है, या फिर कुछ कुछ प्रोटेक्टिव रख के ही जाना है, इसके मुताबिक ही कपड़े पहनने हैं, उसके मुताबिक ही हमें खाना खाना है। ओवर हाइड्रेशन कैसे नहीं होना चाहिए, हाइड्रेशन कैसे रखना है, बॉडी का मेंटेन फ्लूइड कैसे रखना है, और बॉडी को मेंटेन रखने के लिए और कौन कौन सी चीजें हमें घर पे रखनी चाहिए, वो सारी चीजों का पहले रखनी चाहिए, उसका नॉलेज होना चाहिए। और उसके अलावा हम सबको इसके विषय पे थोड़ा सा जानकारी फ्रॉम द स्कूल लाइफ, एवरीथिंग इज स्टार्टिंग फ्रॉम द स्कूल टू कॉलेज एंड एजुकेशन डिपार्टमेंट को उसको इन्वॉल्व होना चाहिए। सारी स्कूलों को भी पता रहनी चाहिए कि हमारे जितने भी छात्र है वो आएंगे, तो उनको इतने इतनी प्रोटेक्टिव तो यूज करना ही है, गम बूट्स तो पहनने हैं, ये पहनना है, सॉक्स पहनना है, इतनी चीजें पहन से ही ये प्रोटेक्टिव रहेंगे। तो इन टर्म्स ऑफ एनी क्लाइमेट चेंज, एंड क्लाइमेट चेंज की सबसे ज्यादा असर बच्चों के अंदर, माल नरिश जितने भी बच्चे हैं उनमें आएगी। तो जितने भी वो है, तो वो सबसे ज्यादा न्यूट्रिशन इज वेरी इंपॉर्टेंट फॉर द बॉडी। माल नरिश बच्चे जितने भी होंगे, तो वो सबसे ज्यादा इफेक्टिव होंगे। इसके लिए मेरा एक पब्लिकेशन भी फॉरेन में, अब्रॉड में पब्लिश हुआ था, तो उसके ऊपर मैंने बोला था कि क्लाइमेट चेंज की डायरेक्ट असर माल नरिश बच्चों को होगी, और उसमें भी सबसे ज्यादा पुअर न्यूट्रिशन सैम मैम लोगों को सबसे ज्यादा इफेक्टिव वो अफेक्ट करेगा क्लाइमेट चेंज के दौरान। तो उसके लिए न्यूट्रिशन इज द प्राइमरी थिंग्स इन एनी वे फॉर प्रोटेक्टिंग अवर सेल्फ, अपने बच्चों को, अपने आसपास के लोगों को, अपने टारगेट जितने भी अपने रिश्तेदार है सबों को बचाने के लिए न्यूट्रिशन के रिगार्डिंग क्लाइमेट चेंज में भी थोड़ा सा नॉलेज होना चाहिए। Yes, sir.
Thank you for your response, but I would like to interrupt with, I would like to disagree with your answer. Sir, मेडिकल इक्विपमेंट्स एंड सब कुछ होना तो चाहिए, बट मेडिकेशंस घर में मौजूद होने से हम उसको यूज कर ले, इस तरह के सजेशंस देना क्या सही रहता है? खास करके कोविड के टाइम मीडिया में बार बार बताया जा रहा था पैरासीटामोल एंड खांसी बुखार के दवाइयाँ इस तरह से नहीं लिया जा सकता, वो कोविड को और कोमॉर्बिडिटीज हो या फिर और कुछ मॉर्बिडिटीज हो तो और बढ़ा सकता है कोविड के इम्पैक्ट। तो घर
Yes.
में मेडिकेशंस मौजूद होने से क्या हम सलाह दे सकते हैं कि आप इसको यूज कर सकते हैं इवन ड्यूरिंग बायोहैजार्ड?
Yeah. Uh, nice. Nicely explained. Now, I want to say you one thing that कोविड के टाइम की बात करें कि कोविड के टाइम पे हम सबको ऐसा बोला गया था कि पैरासीटामोल्स और जितने भी एंटीबायोटिक्स है सभी चीज़ें का हमें नॉलेज मीडिया के थ्रू मिला था, और मीडिया के थ्रू उसका ओवरडोज भी बहुत हो रहा था। तो जैसे ही पर्सनल प्रोटेक्टिव इक्विपमेंट्स और सारी चीज़ें जब भी हम रखते थे और मेडिसिन भी जब भी रखते थे, तो उसमें भी ऐसा था कि बहुत सारी मेडिसिन जितने भी है, इसमें इमरजेंसी मेडिसिन की बात हम अभी कर रहे हैं। जो भी जैसे जैसे क्लाइमेट चेंज होगा उसमें टाइम पे इमरजेंसी मेडिसिन ही अपने पास होनी चाहिए, और जैसे ही डॉक्टर सजेस्ट करे उसके थ्रू ही हमें उसको लेना चाहिए। और इन टर्म्स ऑफ बायोहैजार्ड्स, बायोमेडिकल रिस्क के बारे में बात करें तो जो भी मेडिसिन है वो हमें डॉक्टर को प्रिस्क्राइब की हुई है वही घर पे रखनी है, बाकी और कोई मेडिसिन हमें रखनी नहीं है। और ओवरडोज कोई भी मेडिसिन का ना हो वो भी बहुत ध्यान रखना चाहिए, एक्सपायरी डेट वाली मेडिसिन ना हो वो भी ध्यान रखना चाहिए। और मेडिसिन के अंदर हम बात करें तो जितनी भी प्राइमरी मेडिसिन है उसका लिस्ट बहुत से लोग रखते हैं घर पे, और वो रखना है इसलिए मेरे ख्याल से इन टर्म्स ऑफ इमरजेंसी की बात करें, इमरजेंसी टाइम के इट्स ओके, पर इसको रूटीन यूज में जैसे भी कहीं पे हॉस्पिटल्स नियर बाय है तो वो नियर बाय हॉस्पिटल्स की एडवाइस के थ्रू ही वो यूज करे तो अच्छा है। विदाउट एनी नॉलेज कोई भी मेडिसिन खानी भी नहीं चाहिए। तो मीडिया ने बहुत हाईलाइट किया था एजिथ्रोमाइसिन करके एक मेडिसिन, तो वो भी मेरे ख्याल से इतनी इफेक्टिबल उस टाइम पे भी बोला गया था कि विदाउट प्रिस्क्रिप्शन, विदाउट डॉक्टर्स के एडवाइस के बिना आप कोई भी मेडिसिन ना ले। तो ये अच्छी बात है कि डॉक्टर्स को ही सलाह मशवरा करके ही सारी मेडिसिन का यूज करें और उसके मुताबिक ही अपने घर पे मेडिसिन रखें।
Thank you, Dr. Paresh Surati, for joining with us.
Yes.
Insightful session. Participants, you can ask a question. The floor is still open. Dr. Paresh Surati is with us, and for any more questions, you can reach out to me always. I have shared my contact details in the comment box on YouTube. Kindly get in touch with me, or through your department you can get in touch with me. The drive links are already shared. Drive link already share कर दिया गया comment box में, आप access करके study materials access कर सकते हैं, पढ़ सकते हैं, उसको देख सकते हैं। किसी को अगर गुजराती की जरूरत हो तो आप हमें रीच आउट कर सकते हैं, हम गुजराती ट्रांसलेशन के लिए कोशिश कर सकते हैं, या फिर कोई अगर वॉलंटियरली गुजराती ट्रांसलेट करने में इच्छुक हो तो आप फिर भी हमारे साथ जुड़ सकते हैं। एंड आगे हम कैसे बेहतर बना सकते हैं प्रोग्राम को, इसके लिए भी हम आपसे सलाह मांगते हैं। इसी के साथ आज का ये वेबिनार हम यहाँ पे एंड करना चाहेंगे। थैंक यू डॉक्टर परेश सुराती फॉर ज्वाइनिंग विद अस अगेन, एंड थैंक यू टू ऑल दी concerned departments from animal husbandry to health department, home department, urban development and panchayat rural housing development departments, as well as the department of health and home. Thank you all for smooth coordination and continuous support, ensuring good participation. Thank you participants again for joining with us. धन्यवाद धन्यवाद आप सभी को। हम बहुत आभार मानते हैं कि आप आज महत्वपूर्ण समय निकाल के आप हमारे साथ जुड़े हैं। इसी के साथ हम आज ये वेबिनार यहाँ पे एंड करते हैं। थैंक यू ऑल। Okay, thank you, sir. Thank you, Dr. Surati.